Hi, my name is Jan Wellmann and I'm with Energy for Living. I'm starting a podcast about healing and regeneration with natural methods, self-empowerment, lifestyle, nutrition, attitude, behavior, simple tricks that can up our game. And I'm going to be talking to very interesting people who deal with this every day of their lives. The first one is Dr. Martin Wucher, who's a holistic dentist based out of Namibia, who grew up in the savanna and got to understand both sides of the equation, the indigenous tribes and the city people. When tribal members moved to the big cities, they almost immediately began to have issues with their teeth, followed by chronic disease, followed by weight gain, depression, anxiety, stress, the whole shebang of modern disease cocktail. Martin has dedicated his professional life to this question and how to address causality of disease rather than just drill the teeth. I think we have a lot to learn from him, which is why I'm inviting him to this podcast today.
Thank you, Jan, for having me. It's a really nice opportunity to share many different aspects. I was actually born and raised in Namibia. My ancestors came here in 1904 from Germany. And so I'm third generation Namibian, and my kids again are also here. Some of them are here, some of them are overseas. We grew up on a farm which used to run cattle. Farms here are reasonably big. That was about 9,000 hectares with cattle and game. And then for many years, we had tourism. We had a guest farm with hunting, trophy hunting, and so on. So being close to nature and living in the bush was part of us growing up. And I think that probably triggered me. One of my early passions, my interest was biology and animals and animal behavior. And so when I started after school, I decided to become a vet. And unfortunately, I wasn't clever enough. So I started doing a BSc in microbiology and zoology, thinking that it would get me into veterinary school. At the end of this, I finished that, and I think it was actually a blessing in disguise, because from that time onwards, I've got a very strong affiliation to nature in the way I look at it from a point of ecology, how bacteria interact, how open systems work, and. So this was really my starting point towards my professional studies after. After that, I decided to do dentistry, actually also by chance, because I applied for veterinary school. I still didn't get in. And so I became a dentist. And once again, it suits me down to the ground because I love working with my hands. I love working with people. And when I had finished my dental training in South Africa and Pretoria, I went overseas. I worked there for a couple of years in Germany. Looked at different systems, ways things are done. And as always, picked up things that I would love to do, and also, on the other hand, saw many things that I would rather not do. So with every learning curve, you have got the positives and the negatives, and I believe both of them are equally valuable. So I came back to Namibia in 1989, and I started my own private practice in a tiny little place called Okahanya, which was 20 kilometers from the farm. And we still live on the farm, and I've been practicing in private practice ever since. I went back to university part-time and did another degree in periodontal disease, which is gum disease, implantology, and all that. I did another degree in dental materials and aesthetics, which was all the modern materials, the composites, the ceramics, the titaniums from the implants and the ceramic implants. And then finally, I did a master in dental science, also in materials, in South Africa again. At both those places was University of Pretoria and University of Stellenbosch, which is near Cape Town. And when you are in a private practice for so many years in a small community, and if you've got a biological background, you notice certain things. And I would actually like to jump to some slides, if it's okay with you.
Yeah,
and
absolutely.
Then to explain nature and open systems as a mobile. You know, our body works like that. A farm works like that. A game park, a fish pond. And this was a definition that I really enjoyed. It's a mixture of many million tiny systems all interacting in a very dynamic way. And if it's in a sensible way, the system carries on. If it's moved too little or too much, it actually gets destroyed very often. So dentistry, when I was young, you know, you do everything full of, you use 80% muscle, but you don't really think very much about what you do. And I believe it's lots of professions work like that. When you get older, you see the red lights and you see the things that you can do much more easily. So after a couple of years, I realized that what I was doing, restoring, fixing, and working with dental tissues, soft tissues, and then of course doing root canals because it's part of normal dentistry, those things affected the body. And also watching my patients, I had many that came in like this. You know, when you ask them what sort of medications do you use, and this was one of my craziest prescription I've ever seen. A lady, she was about 70 odd years, and this was her prescription from her doctors. And, you know, something in my mind started thinking, you know, what's happening here? Why is this happening to? And it was an affluent lady, European background. And then on the other hand, you've got this routine behind it. You know, patients go to the doctor, they get a diagnosis, and with that, they get this piece of paper. And ultimately, they get sent home, and people say, look, this is what I'm going to give you. If it doesn't work, come back. And they end up with all these triggers in their system in a modern environment. And for me, it actually popped up certain ideas. I started looking at everything. And actually, if you look at it back today, this is what many healthcare professionals think. And if you look at it biologically, you would want to know, why are so many affluent and wealthy people getting sicker and sicker, and what's behind it? And we've got an amazing environment, because on the one hand, we've got affluent people, and on the other hand, we've got like a natural learning, teaching environment, because some of these guys on the right here, they haven't even got shoes. But guess what? They don't use any medications, and they are healthy. They have got no chronic disease. They might have parasites and they might get hurt by violence or something, but they don't have the same systems. And this is a typical environment that they live in. And there is nothing artificial. Everything that they have here is from the environment. They accrue it and put it together. And when they're done with it after 4 or 5 years, they don't even worry to disband it. They basically just leave it, and it goes back to nature. And also they raise their kids. And as a dentist, you will never see any malformations in these little kids in their teeth when they're in their natural environment and when they eat their age-old foods. When they come to town, they have got all the troubles that we have. So for me, that was basically, where I started thinking about everything and how I got into, I call it functional medicine. So I started looking at the difference between our rural populations and the patients that walked into me, and I spent the last 15 years of my life spending thousands and thousands of hours trying to work out why our modern lifestyles have got these detrimental effects on us. So we have got our emotions, we've got the old viruses, bacteria, we've got all the man-made substances, and then at the bottom right, we've got man-made frequencies, and we'll get back to that time and time again. Now we've got bad man-made frequencies, and we've also got, as you know yourself, fantastic man-made frequencies mimicking nature. So those we can also employ. So these are the big areas that influence our mitochondria. It's basically, it could be a lecture on its own, which we might do in future. This is just a couple of pathways. Now they look overwhelming. The bottom line is that if you've got bad bacteria in your gut, if you've got bad bacteria in your teeth, they will switch up NF-kappa B and mTOR, and these things ultimately will make that mitochondria will drive your cell towards chronic disease and, for instance, cancer. So the old story of what do teeth do teeth can teeth make cancer, which traditionally dentists laugh about, and they call it a lot of hogwash. The real life, or the real story, is that via these signals and these switches, teeth can contribute to chronic disease and cancer. Let's look at some of the dental issues. Here we have a tooth with amalgam in, which is a mixture of several metals and 50% mercury. And I've summed up all the issues that happen there. Besides that, amalgam tends to expand over time, so it puts a lot of pressure on the tooth, and you can see on the tooth at the bottom there's a crack starting already. So it is a plug that fixes a hole, but long term it causes trouble. If you measure the voltage in these mouths, you will see that the composite fillings and the gold fillings hardly make any currents or any electricity in the mouth. On the other hand, if you measure the amalgam tooth against the tissue, you can see the voltage that there is. And this voltage is crazy because it's a couple of 1,000 times higher than your brain voltages. Let's look at root canals. Now, as a dentist, you get taught if a tooth, like on the left, has got a really deep filling and the patient comes in hurting, you will open up the tooth and you will fill the canals, as you can see on the right-hand side. And that X-ray shows a good job. You can be proud as a dentist, but a dentist doesn't look at the microstructure. This is the microstructure. If you look at the tooth on the right, it's got multiple canals. On the left, you see a model. It's actually an animation of what dentine looks like. And these little blue and orange goodies are bacteria. They represent the bacteria. So these guys are sitting in there. This is the electron micrograph of dentine. This is the main tooth structure. And on the middle here, it shows infected dentine, the bacteria that are in there. On the right-hand side, I've got the tip of a file that I use to do root canal treatments. Now, anybody who really believes that they can clean this tissue with an instrument like that is dreaming. Unfortunately, and maybe fortunately, the patients and most dentists don't see these pictures and they don't have the time and inclination to look at it like this. So they still believe that everything's okay. But if you take a tooth here on the left and you can say, look, this tooth is a mixture between a root canal tooth and a periodontal. This tooth had heavy gum disease. It's very much the same as this gangrenous leg on the right here. And we as dentists try and save this tooth. A surgeon on the right-hand side would say straight away, I'm sorry, this leg has to be amputated. So when we look at modern dentistry and we look at the bottom there, this lady had a beautiful smile. She had all dentistry done the right way. You take an X-ray and you see what's happening in her mouth. And then you can see all these areas that are potentially disturbing the body. And she's 58 years and she has leukemia. Now, that was like, this image was taken like 6 or 7 years ago. Ultimately, I removed all her teeth, the ones with the root canals in, and the ones with the infections in. The implants, the dental implants are still there, and she's wearing a plastic denture, which in dental terms is a useless solution, but she is still alive and her leukemia is under control. I cannot tell you that it's directly linked, but I believe there is definitely something to it. Let's get back to the other issues we have in our modern life. We've got all these issues that we see every day. If we open our eyes and we walk through the malls, we see these type of people all around us. Interesting, when you go to the rural areas in Namibia, you do not see not a single fat person. Only when they get to the towns do they have this sort of body shape. And then on the left, you can have a look at the type of issues that come with it. So this is a model that I use in my practice. At the bottom left, we've got food. Why do we use food? Because food modulates the bacteria in your gut. It modulates your healing, your leaky gut. We add movement because your body needs to move. We want spirit and nature to balance your emotional systems. Then we use supplements and obviously some very good foods or diets. We use frequency medicine, which is a modern version of applying the right healthy frequencies to your body. I've got the health professions in bold because I do not want them to go away. I need them. That is where my dentistry is. That is where my medical colleagues are. The physiotherapy and then of course we've got emotions, which in the time of COVID and all that are extremely stressed. They are in the environment causes havoc with our emotions at the moment. And then for a full living, you have to look at the top of this pyramid. In other words, I believe people should have a purpose. They should be able to laugh and joke and tell funny stories. The love at the top is in bold. Why is that? With that, I mean self-love. If you're not able to love yourself the way you are, with all your wrinkles, with all your folds, with all your good and bad points, you will never end up being a happy person. And then the last one is gratitude. Now, our brain always picks up these threads in milliseconds. That's the default hardwired situation. So we have to learn specific techniques to be able to see the good things. And if we do that logically, we get to a summary where we are 90% positives, we have amazing things in life, and only 10% threats. But if you don't do that consciously, you're never going to get there. So this is what we use as a basic folder. We've got these tools. We start with food to modulate the bacteria. That modulates our gut, that improves our liver. From the liver, the heart and the brain benefit if these things are working. So this is a very basic, simple, step-by-step progress, which we implement in our practice. So as you will know, your listeners, it's not just the teeth. The teeth are part of a human being, and we look at the whole human. We don't just look at teeth. And it never stays the same. It'll change all the time. We learn new things, and this is what we try and do. We want to try and get our body going again like a veggie garden that has been fixed up. Okay, so we've looked at the new philosophy. It's really just an awareness that we can use our mind, we can use our brain, we can use our thinking and experience, and hopefully come to new ways of solving problems. So here are the questions. First of all, where does it come from? What has the body, what has happened to the body so that it does what it does? And then when I think of healing, I want to remove the issues that have triggered the body. And then lastly, are we on the way to allow the body to heal? In other words, do we give him enough support? So here's a case. I'm gonna go through 3 cases. The first one is a patient. It's an elderly patient, over 70s, normal weight. She's been eating normal food in Namibia, meaning boerekos is standard, quite a lot of meat, quite a lot of carbohydrates, sugars, and on. She is with her doctor, and the doctor has given her cholesterol medications, he's given her blood pressure medications, and so on the normal standard, I would call metabolic syndrome patient, although she is not overweight. And she's always feeling tired, and she's got brain fog and joint pain. And when people tell me that, I start thinking, these are the medications she's on, and then she has taken 1 multivitamin pill. That was her own. There was no other intervention. So when we look at these problems, we take her and we've got a phase contrast microscope. We take some live blood and we put it under the microscope, and this is what you see. And please remember, what you're seeing now is a video. You can see the little bacteria zooming around, but the blood is not moving at all. So if I sit back and I use my common sense, I would realize that if you want red blood cells to move through tiny, tiny vessels, and they are clogged up like that, they sit on top of each other, you will have the following. Number 1, they cannot exchange any oxygen or CO2 because they're all stuck together. It's like a radiator that's clogged up. So the surface of a erythrocyte of the red blood cell is clogged up. It cannot work. The second point is it cannot move. It doesn't move. So the chances of this thing clogging up a tiny little capillary in the brain, in the lung, or in the kidneys or liver is very good. So this is a stroke waiting to happen. And yet the doctor has done everything right. So what are we seeing here, and why is it happening? We've got rouleaus. When they stick together, the surface tension of red blood cells is low. They don't push each other away, and we've got 2 little electrons and possibly too many proteins. So the treatment aims would be, we reduce the inflammation, we improve the gut health, we try and do all these things here on the left. And providing antioxidant capacity means you supply the patient with more electrons. You can do that with antioxidants. You can also do that by telling them to walk barefoot, getting into contact with negatively charged surfaces, which is the earth, is probably the biggest antioxidant source that we have. So she did all that, and this is what we told her. She drank more water. We put her on omega-3 oils quite a lot. She got a multivitamin, and she basically switched to plant-based diets, not only plants, but say 60, 70%. We gave her a probiotic. We use kefir, and we add flax seeds, ground flax seeds to it as a prebiotic. So the kefir culture lives off the flaxseed, ground flaxseed mix. We dropped her sugars and carbs, and we told her to walk barefoot, and so this is what happened. And so she came back basically 2 months later. Her blood pressure was normal with no medication. The blood viscosity was normal, and her bowel movements were normal. So everything that we want to be normal was normal. And if you look at her blood now, you can see a completely different picture. You can see single erythrocytes. They were moving. you can imagine that they pick up oxygen, they also get rid of their CO2, and when they go through a tiny little capillary, they will not get stuck. They will flow easily. You could also say this is what blood should look like. So this is the first case. This is another one which took a bit longer. This lady was sort of middle-aged in her early 40s, very strong person, muscular. She was a physiotherapist. She had her own gym. And she arrived at our practice on crutches. Needless to say, her mouth, her teeth were ground down. She very, very strong personality. And she had been suffering fibromyalgia, and she had just gone through a horrible divorce and all that. So she wasn't in a good place. Everything that could be wrong was adding to the burden on her body. Also, she took lots of anti-inflammatories, painkillers. Her doctor had put her on a statin, and they proposed replacing the knee. And she herself took glucosamine because she thought it might help. And that was the situation when we started. So the question here is, if we look at a knee joint and we say, okay, a 42-year-old person of European descent, which is a middle upper class person, she has got a car, she's got a warm bed, she's got enough food, she's got a job, everything that we in westernized society think is essential, she had that. And yet her knee packs up at 40. So what is happening here? You look at the old people in the rural communities when they are 80, they will easily walk 15 kilometers a day, barefoot in some cases, with about a 10 kilogram or 15 kilogram water container on their heads, balancing it all the way, chatting, waving their arms, walking along. So what's happening? My take is the knee is breaking down faster than it's being fixed. So where does that come from? Let's have a look. If we assume that the treatment is to balance the body again, this is what we would do. We would reduce the triggers, we would balance inflammation, heal the GI system via the diet. We would try and modulate the immune response. So how do you do that? You can use high dose vitamin D treatments. You can use LDN, low dose naltrexone. That's a topic for another talk. And you get them into the resting state, which is a parasympathetic state. And this is why emotions, sleep hygiene, and getting away from cell phones and Wi-Fi is so crucial. And that, of course, stimulates cartilage regeneration. She came to us in May, April, May, and at the end of the year, this is what had happened. She was walking normally. She had another MRI done on her knee, and the radiologist couldn't believe it because, quite honestly, the knee had grown back the cartilage. And she was playing tennis and walking normally. The cartilage hadn't reached a stage where it was completely smooth, but it was fine. She could walk with it without any pain. So at the end of the time, we used lifestyle modifications, and you see at the bottom right there is, the Germans call it magnetic field therapy, MFT. She came along every 3 months, and we applied frequency medicine to her knee to stimulate the chondrocytes and to stimulate the regrowth of the cell. This is like, you could say 5-6 years ago now. In the meantime, she's done a triathlon and she functions normally. I'm not saying that she will never have a knee replacement, but this to me was fascinating because it showed that the issues that we normally understand cannot be fixed by the body. In this case, it worked. Okay, this is how it looks. This is the person, and we've got these little flat, the Germans call them biotrodes. They are basically little containers with copper spirals in. And the computer system then applies magnetic fields up to 22 Gauss, and they're dynamic magnetic fields. Now what I've done, I've used 2 of these. I apply them 90 degrees to each other. So the one from the side and the one from the top, and they normally run for 15, 20 minutes like this. Why do I apply them at 90 degrees? Because if I had one at the top and one at the bottom, there would be a chance that these waves would either amplify or destroy itself. So I want to run this at 90 degrees. And so far, we've had excellent results if it's for bone healing, if it's for cartilage, if it's for chronic shoulder pain and stuff like that. So it's not only the frequency medicine, it's the frequency medicine with logic, with lifestyle changes, with everything together. And it gives us really exciting results. Okay, the last one, the third case, is a very interesting one. It was a young person, a young male, also on standard diet, and he arrived at our practice in January 2018 or 19, I think. His father actually called me and he said the son is in a hospital in Cape Town and the specialist will in 2 days remove his spleen, because what had happened to this person was that he had developed idiopathic thrombocytopenia. So that does mean the body attacks the little platelets in the blood, and the platelets become less and less, and eventually the blood will not coagulate anymore, and that means he can bleed to death. The normal value for platelets is about 140 plus up. He was, when he arrived at our practice, at 44. Now, normally he would just about go into ICU where we would get a blood transfusion, and he'd had that done twice already. He was on high doses of cortisone, 100 milligrams a day, and he was basically scheduled for a splenectomy, because in traditional medical thinking, if you cannot manage the situation, you remove the organ that removes the platelets. Now, it's a little bit like saying, okay, you've driven along the beach, your disc brakes in the front are full of salt and water and sand. You go to the technician and he says, look, these things don't work anymore, they get stuck, let's remove the disc brake. You don't actually need them because you've still got somewhat 2 disc brakes in the back. That is standard protocol, and there was nothing wrong with doing that, because in 60% of the cases it works. But if it works in 60% of the cases, what about the other 40? Let's look at what normally happens. Okay, let's just go and see what we did. So we tried to remove the cortisone. We upped his vitamin D, and I also used plaquenil, which interestingly enough is hydroxychloroquine, which has been in the news last year and this year quite a lot against COVID. It has been used as an anti-inflammatory. And so we started with that. The cortisone I wanted to come down. I really pushed up the vitamin D because it modulates your immune system. I used NAC for the same reason, and I gave him LDN also to modulate the immune system. I wanted the immune system to calm down against the body itself. I wanted to ramp up the immune system for other issues like viruses and bacteria. So that means you modulate it. You do not just suppress it. And then also we gave him other supplements, and we call it Vitalfeld therapy, VTV. This is frequency medicine. And we started doing that, and the last values we got, after about 4 months, his blood platelets were normal. That is like 2 years ago. You can see the platelets now. His last tests were from about a month ago. He's been absolutely normal. He lives a normal life. All he does is he checks his his lifestyle. He's on certain vitamins, pretty high doses of vitamin D, and he's still on LDN, low dose naltrexone. So what I'm trying to say is, and he still has got his spleen. So there was no surgery, no other interventions. He's basically turned to a normal life again. If you see him today, you wouldn't even think he's got these issues, or he had these issues rather. So what I'm trying to show is that there are always other opportunities. If you prepare to think out the box, if you prepare to think differently, you can reach amazing results in certain cases.
How integral is frequency medicine in understanding the underlying conditions for you?
Okay. Yes, that's a good question. How do you implement that in practice? Now, what normally happens? The people will call my reception. It's just on word of mouth. There is no advertising anyway. And they will say, I want to come to your practice for either the teeth or for, we call them FM issues, functional medicine issues. Then many people have heard about the machine. Now, the machine has got a specific, interesting aura. So people like gadgets, they like modern tools, and they come there and expect, they go onto the machine, do a test, and then from there, their whole life will be laid out until they die. Now, obviously, that is a warped perception. Why do I say that? The machines and the measurements that they deliver to me are a time frame. They're a picture in time. I try and explain it in the way that I say it's like taking a picture of the sky today, and you've got either sunshine with no clouds like we have now in the background, or you have got multiple clouds, and from that you can deduct that the chances for rain or the chances for a hot day are pretty good. It doesn't tell you exactly where it's going to rain. It doesn't tell you exactly how much it's going to rain. So this is how I see it. And I think we need to be balanced and not become hysterical and develop a new religion on these machines. They are fascinating. They are fantastic, but they need to be integrated into the whole of things. So what will we do? The patient walks in. My assistants will put them on it's basically a massage bed, and they will do a scan, in other words, a measurement with the global diagnostics machine. Once that is done, and that takes about 10, 12 minutes, I will come and I will sit down and I will start chatting to them. I'll ask them what their main queries are. I will spend probably half an hour with them trying to elicit what their main complaints and what they expect. And also, I make sure that they have been to the conventional doctors to make sure there is no life-threatening situation at that stage. Now, that is really crucial, because if we in functional medicine, or call it alternative medicine or whatever, and you have a patient that refuses to see a conventional doctor out of principle, he comes to you, he's got diffuse symptoms like stomach pain or headaches or whatever, and he hasn't been for sonars, for MRIs or scans. I think you're very limited in what you can find out. Because if you start giving him vitamins and lifestyle changes, and a month or two later, it gets so bad that he actually ends up having a CT scan or something, and they discover there's a tumor, you have gone the wrong way. So I want patients then treated by conventional medicine first, because that is the risk, eliminating a lot of the risk. If a patient comes along and he says, I've had all these tests and nobody can tell me what's wrong with me, that is when I feel much more comfortable. I can say, okay, because I know that traditionally allopathic medicine looks at stuff that they can see. They either want to see it in a lab test or they want to see it with a imaging technology. And we are crazy, because they will have leaky gut, they will have gut inflammation. They will have either diarrhea or constipation. They will only be able to go to the loo, say, every 4 or 5 days. And eventually they will go for a colonoscopy. A colonoscopy only shows you big macroscopic changes. It doesn't show you the micro level, the leaky gut, the dysfunctional tight junctions and stuff like that. It doesn't show you what bacteria are there. So, and this is where visual imaging techniques have got a shortcut for. We always think we are, as humans, we are visual animals. So when we think we can't see anything wrong, the doctor will say, even a specialist will say, listen, I can't see anything wrong. There is no ulcer in your stomach. I don't know why you've got heartburn all the time. I don't know. And he will not test the stomach acid when he's ingested food. He will look at the stomach and think everything looks okay. So give him ABC drug, proton pump inhibitors and stuff like that, and send him home. And that's not a solution, because yes, it'll limit his gastric hydrochloric acid, but it'll also damage the proton pumps in his mitochondria. So in other words, you try and solve a stomach problem, but you induce massive mitochondrial damage. And if you damage a mitochondria like you do with anti-inflammatories, with proton pump inhibitors, with antibiotics. Remember, antibiotics don't only change your gut biome, the bacteria in your gut, they actually damage mitochondria because they are ancient bacteria. So very few people think that way, and very few doctors can make the connection because they are trained at universities and they are intelligent people and they're often very, very nice people. And they come out, they start practicing allopathic medicine. And when they have to do their training and their continued education, they go to courses that are very often sponsored and dominated by drug-based treatments and options. So what will they learn? They will learn more of the same. And unless they themselves go and have the good fortune and the time to do it in the interest, and I would never have been there if I hadn't had the scientific background. If I'd had a pure medical background, I think I wouldn't be there at all. It's very, very difficult to come out of that loop.
Is there a point where this struck you, or was it more like a gradual realization that, hey, what I've been taught is not exactly right? Or how did that dawn on you?
It's a journey. You don't just wake up and say, look, I'm different now. It's a slow journey. And normally in the way we learn, the way we perceive the environment is, my son always says, if you see something that strikes you, you can never unlearn it or unsee it. So when you start looking at specific things, I believe your brain focuses on them. So obviously, as an example, when a patient comes in and says to me, he has got sensitive teeth. As a dentist, I would go and clean up his teeth. I would apply a fluoride varnish or a sealer to the neck of the teeth. I would make sure that I don't have any caries and stuff. So when a patient, what do we do when a patient says, all my teeth are sore? You have to think a bit deeper. Now, the chances of being a cavitation, yeah, that would be the one tooth, but why is it all the teeth? So the first step is you look at his occlusal patterns and the way he grinds or bites or whatever. So you will normally find it's a very stressed person. It's more middle-aged. Often it's women. And they've got, we call it a fine biotype. They've got thin gums, thin bones, and they grind. And they grind their teeth. So they bend the teeth. So the teeth get micro cracks. And because the tooth is traumatized, make it 6-7 hours at night or whenever they grind, the tooth pulp is in chronic inflammation. It's like somebody's been hitting you on the same place on the arm every day for 3 days. The last time he hits you, he hardly has to touch it, and you'll go through the roof. It's chronic inflammation. That's a one half. That's a local half. The other half is if I test their acidity, either in their saliva or in their morning urine, we normally find that they're very acidic. They're very acidic, meaning the body has got so much acid in it, it cannot get rid of it anymore, either by sweating, because they probably don't exercise that much. It can't get enough acid out by breathing, because only the volatile acids can be breathed out. And the kidneys can't handle it anymore. So what the kidneys do, they pack that acid into the so-called interstitial space. That is the space between the cells. The old Austrians called it Pischinger space. There was an Austrian doctor, Pischinger. He researched the space between the cells, and it's a fascinating area because it's like the road, the public road in a residential area. All the food comes from town via the public road into your yard, and then also all the effluent, in other words, the trash gets put into bags onto the public road again, from where it's going to be moved to the kidneys, to the liver, wherever. Okay, so going back to the Pischinger space, because the person might be eating too much junk food, too much sugar, too much meat, all these things create acids. So the body will pack it away, because we have between 10 and 15 liters of that space. So it's a huge volume in our body. Okay, to get it out at night, the kidneys get going. But when the pH is near 5.5 or even lower, and this stuff gets concentrated in the kidneys, it'll harm the tubules in the kidneys. So the body's clever. It says, okay, to neutralize that stuff, I need minerals. So where does it get minerals? It gets calcium, phosphates, whatever. It goes to your teeth. So it'll remove some of the minerals, and it'll only remove the minerals that the body can get to, and that's inside the pulp. Because on the outside, there is no highway, there is no blood flow, there is no lymph, there is nothing. So the living tooth is one of the reservoirs where minerals get removed and shunted to the kidneys to buffer the acid. The same thing happens with your bones. So this is fascinating, because a woman that has got sensitive teeth, if she goes to the doctor for a bone density test, she will have osteopenia, the start of osteoporosis. So what do? I don't only put stuff on their teeth. I don't only give them an occlusal guard to prevent them grinding at night. I also look at their lifestyle and diets. And guess what? When you do all these things and you get rid of the acid, you change their diet, within 6 months, their teeth are fine. And this is what I call a functional medicine approach. It looks at the teeth, yes. And in some cases, these people have got hardly any cavities. They've got beautiful teeth, and they're young. They're sometimes 40 years old. There's nothing a dentist can really do. And the dentist will just put varnish on their teeth. Yes, it'll help to a certain extent. But that's not the whole story. So if you look, try and find and elicit the whole story. But you have to be open. That means a dentist has to delve into physiology. It has to delve into kidney function, into minerals and all that. And that is stuff you will not hear in dentistry. You have to go to medicine, and especially functional medicine, to get all this information and then build a new way of approaching people. But I can say again and again, I've been in the industry for, make it 35 years. It's after 35 years of doing anything, the fireworks is gone. You've done it, you've been there, done that, you've got the t-shirt. But if you start looking at additional avenues like we do in our practice, it becomes really exciting. And I always try and incorporate whichever tools, and the frequency medicine is one of them. I've just described a patient will come in, there will be a scan, I will look at the scan, and it'll show me a whole lot of critical issues that are not working well. It doesn't tell me whether they've got cancer or not, but it will show me that there's lots of mitochondrial malfunction, if the mitochondria are stressed, if they're dysfunctional, I can tell you this person is heading towards chronic disease and cancer. So I try definitely to improve mitochondrial health. I try and get rid of the toxins. The toxins show up beautifully. I will go and remove the amalgams in a very sophisticated way from their teeth. I don't want mercury to accumulate in their life. I will also discuss and engage them in thinking about having their root canal teeth removed, because root canal teeth, as to the knowledge, as to the information that I have, definitely contribute massively to chronic disease and at the end cancer, because those lipopolysaccharides that come from these bugs that sit in their teeth, they are in your body 24/7. And you don't want your body stressed with stuff like that. You want them to find cancerous cells. You want your immune system balanced. You want it balanced in a way that it sorts out cancerous cells, and also you don't want it to attack yourself. Now we've got an epidemic of chronic disease where all these things happen. We've got autoimmune disease on the one hand, and we've got cancer on the other. What does it tell you? It tells you that the whole system that is responsible for keeping balances, that is completely out of whack, which is the immune system. So then I use lifestyle, or let's go one back. Say I've got the scan from the machine. That's maybe 30% of my testing. The other 30% is clinical. They get long lists of clinical questions like a multiple choice. I give it to them, they fill it in at home. When they come back, I'll get a pretty good idea. And it's linked to specific organs. So now I've got the organs in the scan, and I've got the organs via symptoms on a piece of paper. And then I discuss them, and I get to know how they live, what they do, what they eat, what their job situation's like, what their partnership's like, what their children are doing, their parents are doing. And it gives me a complete big puzzle. And then I try and arrange the pieces in that puzzle that it makes a blue sky and not a cloudy, dark, horrible sky. And by modifying the environment as much as I can, in fact, I don't modify it as much. I give them the tools to do it themselves. And there's one fascinating story. The people that are interested, that are intelligent and committed and keen to do it, they've got incredible results. The people that for whatever reason only come and say, your machine has to fix me or your medicine has to fix me, they don't have any results because they rely on medicine from the outside. Medicine doesn't come from the outside. Yes, you can fix certain physical things, but the body is the ultimate healing machine. And we see it every day. I mean, I remove a tooth, I chop up the jaw, pull the pieces out, grind away, it's bleeding, it looks terrible. But then we rinse it with ozone, we do all sorts of, you give the guys vitamin to push his healing systems and all. The same person comes back 2 months later, you will not even see a wound. And then we implant either titanium implants or we implant zirconium implants, which is the closest we can get to a biological substance in the mouth today. And if you look at that situation 2 years down the road, you can't believe it. In some cases, the artificial teeth look better than the natural teeth next door, depending on the age and so on. So it's not just a mechanical drilling a hole into a jawbone, putting something in, putting a white tooth on top. Yes, that's only the one half. The other half is get the person healthy. And the modern patient, and I presume we do have these type of patients, they are very, very appreciated. I'm appreciative of that. They want that. Many of them, well, I suppose it's because the practice is geared that way and we've got that reputation. They also come with that expectation.
and it's exciting. It's liberating. I feel I'm a healer again. I'm not just a mechanic drilling holes and fixing stuff. Maybe we should make sure that nobody takes it away from us.
I think that is a very fair finishing statement. Let's hope so. And let's hope this type of learning curve becomes more common for many, many more doctors.